Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 20 practice NCLEX questions. Without the way, let's get started.
The nurse has calculated a low PaO2/FiO2 ratio less than 150 for a client with acute respiratory distress syndrome. The nurse should place the client in which position to improve oxygenation, ventilation distribution, and drainage of secretions? 1. Supine. 2. Semifowlers. 3. Lateral side. 4. Prone. The correct answer is 4. Prone positioning is used to improve oxygenation in clients with ARDS who are receiving mechanical ventilation. Which of the following nursing interventions would promote effective airway clearance in a client with acute respiratory distress? 1. Administering oxygen every 2 hours. 2. Turning the client every 4 hours. 3. Administering sedatives to promote rest. 4. Suctioning if cough is ineffective. The correct answer is 4. The nurse should suction the client if the client is not able to cough up secretions and clear the airway. Which of the following individuals has the highest priority for receiving seasonal influenza vaccination? 1. A 60-year-old man with a hiatal hernia. 2. A 36-year-old woman with 3 children. 3. A 50-year-old woman caring for a spouse with cancer. 4. A 60-year-old woman with osteoarthritis. The correct answer is 3. Individuals who are household members or home care providers for high-risk individuals are high-priority targeted groups for immunization against influenza to prevent transmission to those who have a decreased capacity to deal with the disease. When developing a plan of care for an infant with a cleft lip before corrective surgery is performed, which of the following should be a priority? 1. Maintaining skin integrity in the oral cavity. 2. Using techniques to minimize crying. 3. Altering the usual method of feeding. 4. Preventing the infant from putting fingers in the mouth. The correct answer is 3. Before corrective surgery for a cleft lip, the infant needs to consume formula or breast milk. Methods for feeding may need to be adjusted to fit the infant's needs because the infant with a cleft lip experiences a decreased ability to suck, which interferes with the infant's ability to compress the nipple. The nurse is administering gastrostomy feedings to an infant after surgery to correct a tracheoesophageal fistula. To prevent air from entering the stomach, once the syringe barrel is attached to the gastrostomy tube, the nurse should 1. Unclamp the tube after pouring the complete amount of formula to be administered into the syringe barrel. 2. Pour all of the formula to be administered into the syringe barrel after opening the clamp. 3. Maintain a continuous flow of formula down the side of the syringe barrel. Once the clamp is opened, allow a small amount of formula to enter the stomach before pouring more formula into the syringe barrel. The correct answer is 1. The best way to prevent air from entering the stomach when feeding an infant through a gastrostomy tube is to open the clamp after all the formula has been placed in the syringe barrel. Doing so prevents air from mixing with the formula and thus being introduced into the stomach. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. Which of the following should the nurse assess in a newborn diagnosed with an anorectal malformation? Select all that apply. 1. Abdominal distension. 2. Loose stools. 3. Vomiting. 4. Meconium in the urine. 5. Meconium stools. The correct answers are 1, 3, and 4. Anorectal malformations present with lack of stool or evidence of meconium in the urine through a fistula. A newborn admitted with pyloric stenosis is lethargic and has poor skin turgor. The primary care provider has prescribed IV fluids of dextrose water with sodium and potassium. The baby's admission potassium level is 3.4 milliequivalents per liter. The nurse should 1. Notify the primary care provider. 2. Administer the prescribed fluids. 3. Verify that the infant has urinated. 4. Have the potassium level redrawn. The correct answer is 3. Normal serum potassium levels are 3.5 to 4.5 milliequivalents per liter. Elevated potassium levels can cause life-threatening cardiac arrhythmias. The nurse must verify that the client has the ability to clear potassium through urination before administering the drug. A prima gravida client is admitted as an outpatient for an external cephalic version. The nurse should assess the client for which of the following contraindications for procedure: 1. Multiple gestation. 2. Breech presentation. 3. Maternal Rh-negative blood type. 4. History of gestational diabetes. The correct answer is 1. External cephalic version is the turning of the fetus from a breech position to the vertex position to prevent the need for cesarean birth. Genital pressure is used to rotate the fetus in a forward direction to a cephalic lie. Contraindications to the procedure include multiple gestation because of the potential for fetal injury or uterine injury, a primiparous client who has just given birth to a healthy term neonate after 12 hours of labor, holds and looks at her neonate and begins to cry. The nurse interprets this behavior as a sign of which of the following? 1. Disappointment in the baby's gender. 2. Grief over the ending of the pregnancy. 3. A normal response to the birth. 4. Indication of postpartum blues. The correct answer is 3. Childbirth is a very emotional experience. An expression of happiness with tears is a normal reaction. A primiparous client has just given birth. The primary healthcare provider has informed the labor nurse that he believes the uterus has inverted. Which of the following would help to confirm this diagnosis? Select all that apply. 1. Hypotension. 2. Gush of blood from the vagina. 3. Intense, severe, tearing type of abdominal pain. 4. Uterus is hard and in a constant state of contraction. 5. Inability to palpate the uterus. 6. Diaphoresis. The correct answers are 1, 2, 5, and 6. Uterine inversion is indicated by a sudden gush of blood from the vagina, leading to decreased blood pressure and an inability to palpate the uterus, since it may be in or protruding from the vagina, and any signs of blood loss, such as diaphoresis, paleness, or dizziness, could be observed at this time. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is caring for a prima gravida client in active labor who has had 2 fetal blood samplings to check for fetal hypoxia. The nurse determines that the fetus is showing signs of acidosis when the scalp blood pH is below which of the following? 1. 7.5. 2. 7.4. 3. 7.3. 4. 7.2. The correct answer is 4. If the fetus is hypoxic, the pH will fall below 7.2 and be indicative of fetal distress. Crisis intervention plays a major role in the management of care for clients with chronic mental illnesses. Although the safety of the client and others is always a priority, these clients typically need crisis intervention in which of the following situations? Select all that apply. 1. Inability to keep outpatient appointments. 2. Signs of relapse and decompensation. 3. Threat of eviction from housing. 4. Unpaid bills and lack of food. 5. Occasionally missing a dose of medication. The correct answers are 2, 3, and 4. Although all of the situations require immediate attention, the inability to keep outpatient appointments is less critical than signs of relapse and decompensation, threat of eviction, and unpaid bills and lack of food. A 69-year-old client is admitted and diagnosed with delirium. Later in the day, he tries to get out of the locked unit. He yells, "Unlock this door. I've got to go see my doctor. I just can't miss my monthly Friday appointment." Which of the following responses by the nurse is most appropriate? 1. Please come away from the door. I'll show you your room. 2. It's Tuesday and you are in the hospital. I'm a nurse. 3. The door is locked to keep you from getting lost. 4. I want you to come eat your lunch before you go to the doctor. The correct answer is 2. Loss of orientation, especially for time and place, is common in delirium. The nurse should orient the client by telling him the time, date, place, and who the client is with. Which of the following is a realistic short-term goal to be accomplished in 2 to 3 days for a client with delirium? 1. Explain the experience of having delirium. 2. Resume a normal sleep-wake cycle. 3. Regain orientation of time and place. 4. Establish normal bowel and bladder function. The correct answer is 3. In approximately 2 to 3 days, the client should be able to regain orientation and thus become oriented to time and place. The nurse has placed the intubated client with acute respiratory distress syndrome in prone position for 30 minutes. Which of the following would require the nurse to discontinue prone positioning and return the client to the supine position? Select all that apply. 1. The family is coming in to visit. 2. The client has increased secretions requiring frequent suctioning. 3. The SpO2 and PO2 have decreased. 4. The client is tachycardic with drop in blood pressure. 5. The face has increased skin breakdown and edema. The correct answers are 3, 4, and 5. The prone position is used to improve oxygenation, ventilation, and perfusion. The importance of placing clients with ARDS in prone positioning should be explained to the family. The positioning allows for mobilization of secretions, and the nurse can provide suctioning. Clinical judgment must be used to determine the length of time in the prone position. If the client's hemodynamic status, oxygenation, or skin is compromised, the client should be returned to the supine position for evaluation. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. A client with acute respiratory distress syndrome is on a ventilator. The client's peak inspiratory pressures and spontaneous respiratory rate are increasing, and the PO2 is not improving. Using S-bar communication, the nurse calls the physician with a recommendation for 1. Initiating IV sedation. 2. Starting a high-protein diet. 3. Providing pain medication. 4. Increasing the ventilator rate. The correct answer is 1. The client may be fighting the ventilator breaths. Sedation is indicated to improve compliance with the ventilator in an attempt to lower peak inspiratory pressures. The workload of breathing does indicate the need for increased protein calories. However, this will not correct the respiratory problems with high pressures and respiratory rate. There is no indication that the client is experiencing pain. Increasing the rate on the ventilator is not indicated with the client's increased spontaneous rate. Which of the following interventions should the nurse anticipate in a client who has been diagnosed with acute respiratory distress syndrome? 1. Tracheostomy. 2. Use of a nasal cannula. 3. Mechanical ventilation. 4. Insertion of a chest tube. The correct answer is 3. Endotracheal intubation and mechanical ventilation are required in ARDS to maintain adequate respiratory support. A confused client with carbon monoxide poisoning experiences dizziness when ambulating to bathroom. The nurse should 1. Put all 4 side rails up on the bed. 2. Ask the unlicensed personnel to place restraints on the client's upper extremities. 3. Request that the client's roommate put the call light on when the client is attempting to get out of bed. 4. Check on the client at regular intervals to ascertain the need to use the bathroom. The correct answer is 4. Confusion and vertigo are risk factors for falls. Measures must be taken to minimize the risk of injury. The nurse or unlicensed personnel should check on the client regularly to determine needs regarding elimination. Which of the following assessments is most appropriate for determining the correct placement of an endotracheal tube in a mechanically ventilated client? 1. Assessing the client's skin color. 2. Monitoring the respiratory rate. 3. Verifying the amount of cuff inflation. 4. Auscultating breath sounds bilaterally. The correct answer is 4. Auscultation for bilateral breath sounds is the most appropriate method for determining cuff placement. The nurse should place a client being admitted to the hospital with suspected tuberculosis on what type of isolation? 1. Standard precautions. 2. Contact precautions. 3. Droplet precautions. 4. Airborne precautions. The correct answer is 4. Airborne precautions prevent transmission of infectious agents that remain infectious over long distances when suspended in the air. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.